Nikola Jokic, MVP center from the Denver Nuggets, suffered a left knee injury on this play here against the Miami Heat. My name is Ryan. I'm a physical therapist. I'm going to go over the mechanism of injury, what injuries could potentially happen because of this play, as well as the potential prognosis for Nikola Jokic. We see that Nikola Jokic gets stepped on at the ankle, which then causes a hyperextension at that knee joint there. That left knee does shoot back quite quickly. However, it was not an extreme amount of hyperextension, which is a good thing for Nikola Jokic and the Denver Nuggets. Another good component of this injury is that there's not a lot of rotational force going through that knee. Primarily just hyperextension, maybe a little bit of valgus stress in the knee. However, when there is this amount of hyperextension, you do have to be concerned for putting a lot of stress through that ACL and PCL ligaments in the knee joint. Here, if we take a look at our knee joint, when that knee does hyperextend, that's going to put a lot of force going through the front of that knee joint. This can easily and most likely will cause some bone bruising, and that will be more in this front part of the knee. Or as mentioned earlier, with hyperextension injuries, you do really want to worry about your ACL and your PCL ligaments here. That could potentially cause either a sprain or even a complete tear. Prognosis wise, the best case scenario would be a bone bruise. That could be just about 1 to 2 weeks of missed time for Nikola. Our worst case would be involving that ACL or PCL and either a sprain or maybe even a complete tear. I think everyone's hoping that it is just a bone bruise because no one wants to see Nikola Jokic miss a whole season if it is a complete tear. He does make the NBA better with his unbelievable play, so hoping that he'll have a speedy recovery from whatever it is and he'll be back on the court real soon.